and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I'm streaming live from the Moses Lake Professional Pharmacy Studio today. And I am super excited to have back on our show the man, the myth, the legend, my twin brother, Shane Needham, bodybuilding champion, powerlifting champion, an all-around good guy and a super smart individual. Shane, welcome to our show.
Thank you. It's an honor. Thank you very much. I'm super excited to be here.
So let's tell our audience a little bit about how this conversation came up. I started a few months ago basically discussing how, in healthcare, we're so good about testing, doing laboratory tests, and all these kind of laboratory tests to tell how healthy somebody is. And I made a short little quick video saying, I'm done. For myself, I've been chasing labs for the last couple of years just to see how healthy I am. And some will show up that I'm not healthy, i.e. my glucose, for instance. And my glucose runs a little high. Well, why does my glucose run high? My glucose runs high because I burn glucose. I'm an endurance athlete, and when I do bike rides, my glucose average is 140, which if anybody's never done a continuous glucose monitor, it's interesting to find out what happens. Exercise will increase your glucose while you're exercising. So I'm burning that glucose, so my glucose runs a little bit high. Somebody that doesn't know me, i.e. a doctor that doesn't know me, will say, well, Shawn, you're pre-diabetic. Well, why don't we just think about this for a while? What's my insulin level? My insulin level was super low. Anyway, once I did that process, I'm like, you know what? I'm done chasing labs. We don't need labs to tell people that they're healthy. Why don't we just look at people? We can look at people and see if they're healthy or not. And usually people that have metabolic syndrome and they have bad glucoses, which even though mine was bad, mine wasn't unhealthy, we can tell that by looking at them. So then I had a discussion with you, and you kind of talked about the history of laboratory testing. And because you're an expert in that subject, that's why we're having you on. So go from there.
So yeah, thanks, Shawn. Thanks for the introduction. So I certainly am, I'm not painted with one brush, but I'm a disciple. I'm a soon-to-be husband. I'm engaged to a wonderful lady. I'm also a father of 4. I'm also a scientist. I'll get to that in a minute because that's where my laboratory testing expertise comes from. But I'm also a national bodybuilding champion, a state powerlifting champion. I've done podcasts as well, my own podcast. I'm an author, so on and so forth. But what we're going to be talking about today is called analytical chemistry. And that means where you're analyzing your blood or maybe urine or whatever it is, and then you're doing a chemical test. We also can call that precision medicine. In our field, we call it precision medicine. It's looking at your laboratory test to say, hey, are you optimal or not? And this industry is only 50 years old. And I'm not going to get into too much of the history. And I've written on this before and done some other blogs on this, and some presentations. But analytical chemistry, as we think about it today, where you're doing lab testing, is less than 100 years old for sure. And it's always getting better and better. So we have more and more instruments. And the reason we test these, the reason we do certain tests biologically, you know why? Because we can. That's it. Do the numbers actually mean you're healthy or not? No, not necessarily. Right. Okay, so remember, what did you do 100 years ago? Somebody would say, well, take this herb, see if you feel better. Oh, I don't feel better. Well, take more, see if you get sick. Oh, well, I got sick. Okay, take a little bit less. Oh, I feel really good now. I feel really well. That's how it used to be done. And that's how we've done it historically, in like medicinal plants and herbs and so on and so forth. A lot of these things are actually in nature, right? And that's how we used to do it. We would take this, and Shawn, certainly you know better than I do, but certainly you would take a certain medication, see if you felt better. Like you'd go to your shaman, right, in your tribe, and you'd say, man, I have a sore throat. And he'd give you some piece of bark or something, and he'd say, here, take this. Do you feel better? No, not really. Well, here, take a little bit of more, or I'll give you something else. Well, now I threw up, or I got dizzy. Okay, well, take less. Oh, yeah, now I feel great. That's how it used to be done. Now what we can do, and it's actually very, very good that we can actually do these tests. And science has been absolutely great in the evolution of analytical instrumentation, whether it be mass spectrometry, chromatography, these other types of tests, right? Now what we do is typically you'll tell your doctor, well, I don't feel well. So you go in and you take a series of tests, right? And they say, okay, your electrolytes are low, or your blood glucose is high or whatever it has. Now, I think there can be a need for that. I agree with Shawn. The first thing the doctor should look at, actually, not the doctor, you, the individual, look in the mirror. And when you say metabolic disorder, Shawn, what do you mean by that? Is there a specific metabolic disorder you're talking about? That's a very broad range.
Oh, well, I mean, for one, type 2 diabetes. But again, because the way we diagnose it in our precision medicine, our analytical medicine, some people will have type 2 diabetes before they have a high glucose. But you check their insulin level and it's super high, which means they're insulin resistant. So really, you should look at a person, if they're 150 pounds overweight and they're not diabetic or they're not diagnosed as diabetic yet because their glucoses don't meet that range, believe me, they're a diabetic. They have metabolic problems already. They do. They're 150 pounds overweight. So they are not metabolizing their glucose like they should, i.e. they're probably releasing a lot of insulin and they still have, but they still have normal glucoses for now. But that doesn't mean that they're metabolically healthy.
Right. So is obesity a metabolic disorder?
Absolutely.
Okay. So you actually said type 2 diabetes. That is what would you say, a subcategory, or it is caused by obesity in general?
Correct.
Okay. Let's just say
not always. Yes, for you haters out there that think I'm fat shaming and think I'm always, picking on obese people, even though it's the most dangerous thing we can do as an American. Yes, there are exceptions to that rule. There are thin people that are type 2 diabetics. But let's remember what the diagnosis of diabetes is. It literally means diabetes mellitus. It literally means honey siphon. You are urinating out too much sugar. Still, sugar comes from carbohydrates in our food. No matter what, if you're obese or not obese, if you have type 2 diabetes, if you limit your carbohydrates, you will reverse your diabetes, period. Go.
And a lot of type 2 diabetics that aren't overweight, it's because they possibly drank too much and ruined their pancreas or something, or had some other disease of the pancreas. It's probably environmental. I'm not saying that's always the case, but point of it is obesity is the most dangerous thing we can do. I think it's the number one killer now. Is that true?
Absolutely, it's true. It passed up smoking in 2016. More people die of cardiovascular disease related to obesity than smoking, period.
Wow, that's interesting. Okay, so let's get that done over with. So I think, in other words, you should be able to even tell yourself, are you moving? When I say moving, I don't mean walking and counting your steps every day. Okay, I'm not going to shame anybody here, but that's a waste of time.
No, let's back up on that. Remember, you're a competitive bodybuilder. I'm a competitive mountain bike racer. But when I was obese, 60 pounds heavier, 12 years ago, walking is a start. So
okay, you might be right.
Walking is a start. Absolutely. But you have to progress.
Here's the research. Here's the research I've read. Walking alone, just by counting the steps that you do every day, is not making you more healthy than structured exercise, where you tell yourself, I'm going to go walk an hour every day.
Okay, there you go. Boom.
That's what I'm saying.
Absolutely.
By going to the refrigerator and opening the door and then going back and watching TV and eating your Doritos, that does not count. It just really doesn't.
No, bottom line is, but you still have that pedometer, and you can click it off the box. I mean, remember, we want to make things easy today for people. We want to normalize this stuff. So that's what we do.
Anyway, back to laboratory tests. My point of it is that you should be able to, are you doing structured exercise 4 or 5 times a week for an hour each time? Do you eat the right foods? Are you overweight? And in other words, and I think I've talked about this on your show before.
Remember, Shane, you're overweight. Let's talk about weight versus ideal.
I was going to talk about that. Okay. Are you obese? Male or female, can you look down and see your toes? You should be able to. Does your belly hang over your belt? It shouldn't. It just absolutely shouldn't.
And by the way, it doesn't matter whether you're 8, 18, or 80. It's all the same.
That's right. It is. This is your belly should never do that, male or female. And so most people know if they're overweight, and you should, in general, be able to pull up your shirt, look in the mirror, and say, "Hey, can I kind of see the design of my abdominals?" You should be able to see that. So anyway, you should be able to know if you're healthy. That's a healthy person. It just is. You're not going to have metabolic disorders. So if that's all true, and you're eating correctly, you're eating whole foods, you're eating a lot of protein, a lot of meat, including red meat. You're eating a lot of meat.
Red meat won't kill us.
I know.
I thought it was
The latest
I thought it was killing people.
I know. No, if you're following that type of a diet, and then you're not eating packaged foods, you're not eating Doritos and Cheetos. I think that is it. Doritos or Cheetos that you always talk about, Shawn?
I get them mixed up all the time. And sometimes I use beer, sometimes I use wine.
Anyway, so point of it is you're eating whole foods, right? So if you're doing all that and you still don't feel well, visit the doctor. Get your laboratory test done, and maybe for some reason something's going on. Okay, and then you can start saying, okay, I don't know, think of a good number, Shawn. Think of something that scenario where somebody might be off, maybe a thyroid or something, maybe.
Yeah, let me discuss thyroid. I was going to go
Okay.
into that. So speaking of laboratory testing, being, I think you said 50 or 70 years old, something like that. I use thyroid example quite frequently, and here's why. So Armour thyroid, very popular thyroid is called NP thyroid. It's been around so long, it was pre-FDA. So it's not FDA approved because it was around before the FDA was. Actually, NP is porcine thyroid. It is literally comes from ground up pig's thyroid. Literally. It came out in the late 1800s, popularized in the 1920s. We didn't have good thyroid testing until the 70s. Now, there was some testing in the 50s, but it wasn't very sensitive. You would know more about that than I would. So we didn't have good testing until then. So you remember Dr. Richard Munch, right?
Yeah.
Yeah, he delivered us. He was a physician in Othello. He delivered Shane and I in 1970. And I give this story all the time because I was at a seminar one time, and I was educating a bunch of healthcare professionals about thyroid. And Dr. Richard Munch was there. He'd been practicing in Othello, Washington since the early 1960s. And I said, hey, and then I was talking about thyroid testing and how important it is to look at labs, to treat symptoms and history, and not just labs. Labs are a tool to go along with symptoms and history. And I said, and somebody raised their hand, well, TSH is gold standard. The endocrinologist says gold standard, and we got to use TSH. And I'm like, hey, Dr. Munch, back of the room. Back in the 1960s, before you had thyroid testing, did you prescribe thyroid? Yeah, I did. Oh, so tell me how you went about that process. Well, they'd come in with their symptoms, and they had symptoms of, losing their hair, low energy, decreased libido, cold extremities, depression, low thyroid symptoms. We do a physical exam and we palpate their thyroid. What? You would actually give a physical exam? That's quite a concept. Whoa. Okay. I mean, seriously, I mean, we laugh about it, but that's why I'm cynical about it, because it doesn't happen a lot anymore. Yeah. So we'd palpate their thyroid, and then we'd give them a trial of thyroid, and we'd see how they did. If they come back, a few weeks later, and they said, well, I'm better, but not quite good enough. Okay, well, let's increase the dose. Well, I got a little hot at night. I had some hot flashes, or my heart raced a little bit. Okay, let's back off on the dose. No thyroid testing, no laboratory testing.
Yeah.
And you might know this because you have a son that's a type 1 diabetic. We had porcine and bovine insulin back in the 1920s for type 1 diabetes, but I don't think we had glucose testing. So what'd they do then?
Yeah, well, that's a good point. They did. Glucose testing didn't come around until the 40s, and then it had to be done in the laboratory. But they it's a great story because insulin is now 100 years old of giving it to type 1 diabetics.
Right, 1923, I think it was.
No, 1922.
Was it 22? Okay.
I just gave a presentation on it a couple of weeks ago at a conference, and basically what they did is, these scientists in University of Toronto up in Canada, they had this ward at this medical facility in Toronto, and it was just basically sick diabetic kids, right? It was sick diabetic kids who were late stage type 1 diabetics, and they were dying. They had no muscle tone. They were skinny. They were all unconscious, right? And he had this idea that he was going to extract insulin from this pig pancreas, and he started injecting these kids about 20 in a row. And by the time he got to the 20th one,
it was instant.
Well, not instant, but by the time you got to the 20th one, number one started waking up.
I know, right? I mean,
And so
almost.
it's a wonderful story.
It
But
is.
the point is that they didn't test insulin, they couldn't test glucose, but and they were okay. And has personalized testing for type 1 diabetics revolutionized how you treat yourself? You bet. You bet. And so when we say laboratory test, I don't count that as a laboratory test. That is a personal test. That is a personalized medicine test where you're testing your glucose via your handheld monitor to see, how much you can eat, what's your blood glucose level, what you ate, and then if you need to adjust your insulin levels. Anyway, you get to laboratory tests. You say, hey, we've only had laboratory tests for 30 years of doing TSH, I think. Is that what you said? Correct?
TSH, yeah.
Yeah. So, for example, let's talk about that a little bit. So these tests change all the time. And I'll give you an example of the prostate test, and the range of what's normal changes every 3 or 4 years. And you know why that is? It's not because people's ranges change. That's a whole different story. It's because the tests change. The tests actually are better than they used to be. So what we tested 20 years ago and was a good PSA level, for example, for prostate or TSH, it might have been wrong, so to
The
speak.
sensitivity change, is that correct?
Yes, it's actually usually selectivity. It's usually selectivity change. So they might get a false positive or a false negative or something like that. So they make more of a selective test. And it's like, okay, this is better now. Does it mean it was wrong before? No. I don't like to say any test is necessarily wrong because it's always data. Then you have to interpret it as a scientist to see what it actually means and what you're going to do with that data. But that just goes to show you that's always going to happen. These tests are always going to be changing.
Well,
so it really does come down to, how do I feel?
Right.
Let me ask you a question. Like if somebody was on a female on progesterone, testosterone, estradiol. I mean, like for example, you talked about extremities with TSH. Do testosterone or progesterone ever change? Like if your extremities are cold or warm or anything like that too?
Not necessarily directly, but there's a lot of symptoms that testosterone and thyroid, for instance, they mimic each other. So when you look at depression, when you look at energy, when you look at weight gain, when you look at things like that, testosterone and thyroid mimic each other. So you can't really diagnose it with one or the other. You got to do both, especially with females. With males, especially if they're in their late 40s or early 50s or beyond, it's pretty easy. It's testosterone. But with women, it can be their thyroid issues also.
That's interesting. So
let's
laboratory
back up just a little bit. Let's back up just a little bit. When you said the scientist has to interpret the data, that's a great point. And I say this all the time when I'm educating healthcare providers on how to test hormone levels. The important thing is know what test to order, but also how to interpret the data. And sometimes it's worthless.
Yeah.
I mean, like for instance, and I said, you won't believe how you can take the wind out of somebody's sails, whether it be a patient or whether it be a healthcare provider, because the patient has not been taking their testosterone for like a week, and they check their level, and they're back down to baseline. Well, of course they are. I mean, it's a wasted test. It is a wasted test if you're trying to find out what kind of dose to put them on. So, or we see the same thing. You test it right after they administer the testosterone.
It's too high.
Levels are high. Oh my gosh, the guy's gonna have a heart attack. Take a deep breath.
Yeah.
Take a deep breath. Okay. If you don't like that level, wait about 5 or 6 hours and it'll be back down to 800. Okay.
Right.
So, you have to know how to interpret it appropriately. That's why sometimes, and here's the problem, and this is why I kind of want to have you on. I think there's a problem when you start chasing labs. I was guilty of that with my glucose. When I had a continuous glucose monitor, I was chasing my labs. First of all, and why don't you hit on this subject too, about what's happened with personal glucose testing, including continuous glucose monitoring. People eat like crap, and then they chase their labs. You know what? If you eat consistently and you know how you exercise and you know what to do with your body, you don't need to test, right?
Yeah, it's true.
Is that true with diabetics too? Let's not get too specific because I know there's some details, but in general, that's true. In fact, we already said that in 1922 when we gave people insulin, we weren't monitoring it, and we made them. We brought them back from the dead, literally.
They survived, but it wasn't optimized, and laboratory tests didn't help that either because you had to go to a lab. So for type 1 diabetics, you have to have a handheld device where you're going to be able to understand your actual levels. But you're right. I think one of the biggest disservices to type 1 diabetics, and especially type 2 diabetics, which is all environmental, if you were a type 2 diabetic, you caused it. You caused it. You overate. You loaded up your pancreas. You stressed out your pancreas. That is all reversible. It's all reversible with a change of lifestyle. Get moving. Get rid of your carbohydrates. You don't need those. Okay, you just don't. For your lifestyle, you probably don't. I'm telling you, you had too many in the first place. Okay,
that's true.
But for a type 1 diabetic, as an example, if you absolutely should be on a low carbohydrate diet, you will never. I think one of the biggest disservices in our industry is a continuous glucose monitor for type 1 diabetics and a insulin pump. Horrible. You know why? Because it makes it seem like it's an awfully convenient disease.
It creates bad habits.
Creates very bad habits. So you can go in and, hey, you know what? The insulin pump manufacturers and continuous glucose people talk about this. Oh yeah, like you can have like a party setting where it ups your insulin. Like
seriously,
you can do, and your endocrinologist, the bad ones anyway, which most of them are, they actually are. They'll tell you, yeah. So it'd be like, if you're just snacking all day at a New Year's Eve party, no, on cookies and cake, just don't.
Right.
You will never. I'm telling you, I have a type 1 diabetic son. I did research on him when he was asleep, and I saw what would happen because I wanted to make sure that he was on the right path and the right trajectory to make sure he's going to be healthy. It is not possible to have a high carbohydrate diet and have a healthy type 1 diabetic. Period.
I get into debates on forums all the time on social media with pharmacists even that say, Shawn, you don't know the difference between type 1 and type 2 diabetes is. Type 1 diabetics do not have to monitor what they eat, and they don't have to monitor their carbs. BS. It's a lie. That's a complete lie.
I'll give you a good book to read. It's called Diabetes Solutions by Dr. Bernstein. He was a type 1 diabetic diagnosed in the 1940s. He is now 90-something and has an A1C of less than 5. It's usually 4.8. I think he tests once a week. He's a type 1 diabetic.
Wasn't he instrumental in starting personalized glucose testing?
Handheld. They wouldn't have handheld devices if it wasn't for him.
Because the doctors at the time thought patients didn't know how to interpret them, right?
Yeah, didn't know how to interpret them, and it could never be done on a large scale. So so at that point he was an engineer, and what he did is he actually went back to med school so people would believe him, and then wrote the papers, and the rest is history. And so,
haven't you personally talked to him?
I have on the phone. Yeah.
Yeah. When you were trying to,
I was researching how to treat my son.
Your son.
And this is the only way to do it. And it has a lot of, if you're type 1 diabetic, it has a lot of information about type 2 diabetes too. I skipped those chapters because that's all, and he talks about it. It's all environmental. But yeah, it's a really, really good book, and it will change how you treat your diabetes. But that's not a laboratory test. That is a personalized medicine test. Again, type 1 diabetics, that's what he was finding was the problem. Is he would have to go get these laboratory tests. He couldn't control them himself. So you would go in the 1940s, 50s, 60s once a month and get your urine tested, not even blood back then, and which is a whole different story. That's not even accurate because it's not systemic. It doesn't talk about what's happening. It talks about what happened. But it was too late. Well, then they'd adjust but believe me, endocrinologists still do that today. They still do that.
Well, I mean, look at what we do when we chase hemoglobin A1C. I mean, we chase those all the time, and they're a 90-day reflection of what your glucose is.
Right.
I mean, I remember when I learned about it in pharmacy school and it was just first coming out and how it was going to revolutionize the industry. The honest to gosh truth is that in some ways, when we get more of these tests, it gives people in some ways it gives them a reason to cheat, because like A1C, for instance, if their glucose was 400 during one day, it's not going to affect their A1C that much over a long term. So if they got to turn in their glucose numbers, they know what's here again. They know what's happening, and that's why we don't have to have tests for this. People know when they're not eating well. People know when they're not moving right, whether they're diabetic or not. I mean, like you say, let's just look in the mirror.
No, I'll give you an example of a test that I always, not always, but usually fail. And you'll have to help me out with some of the names of these, but it's the Bun test,
A
the creatinine
BUN,
test. What's another kidney test?
creatinine,
Creatinine. But isn't there's the Bun. What else?
creatinine, BUN, maybe protein, maybe you can do an ultrasound of your kidneys, but creatinine is one where that comes from muscle mass. So traditionally, anybody that has a lot of muscle mass, so men's creatinine is obviously higher than a woman's creatinine number, and anybody that has a lot of muscle mass will have a larger creatinine for obvious reasons. Well, doctors won't catch that. Mine's on the borderline high, maybe even a little bit high. I'm not as muscular as you are. Yours is higher than mine because you're a bodybuilder. So it looks at the breakdown of muscle mass. So if you are a strength trainer or even an endurance athlete where you're breaking down muscle all the time, it's going to excrete it in your kidneys and it's going to look high. But as a clinician, you should look at that and say, wait a minute, this guy works out a lot. He's an athlete. His creatinine is going to be high because he's breaking down muscle all the time. Now, I know as a bodybuilder, you don't like to believe that because you don't like to be catabolic, but no matter what you are, and you just have a higher muscle mass. So that creatinine is going to be higher. I've seen doctors literally, freak out and think somebody's going into renal failure when they have a high creatinine. But you look at the guy, it's like, I don't think there's a problem.
Yeah. And so that's when I always fail. But, and so I talked to you about it because I had some doctors, and unfortunately doctors don't really know about it. And they think actually, high protein diets cause this. It's not, it's the muscle mass. And that's why in the literature many years ago, high protein diets supposedly lead to kidney failure. No, I'll tell you what leads to kidney failure. Insulin resistance and high carbohydrate diets.
Well, and why do you think kidney failure is at an all-time high in America? Because of type 2 diabetes.
It's not because of bodybuilders.
It's because of diabetics.
Right.
The nephrologists and kidney centers love diabetes.
Yeah.
Because they are, over the last few decades, they have exploded because so many people are in renal failure because of their diabetes.
So high protein diets do not do that. It's actually insulin resistance that causes the inflammation. I don't remember the exact biochemical pathway. I was just reading it the other day and I forgot about it already. But it's high carbohydrate diets. And so,
well, let's think about it. Let's just think about evolutionarily speaking. Okay. So as hunters, Shane, when we killed an animal, in fact, you and I had a podcast on this. We talked about how much protein can you absorb at once. Well, when we killed an animal, hundreds of years ago, and we would feast on this animal, basically pure protein and fat, we didn't go into renal failure.
Right, exactly.
And that was a lot of protein.
It was a lot of protein.
With pounds of meat.
Yeah. And so I've had to, and I can't remember the test now, but I should look it up. But do you remember the kidney test that you can do? Sean Baker recommends it. That's what he does because he fails it all the time too. I want to say cisplatin A, but that doesn't sound right.
No, that's a drug. So
creatinine
clearance, maybe creatinine clearance, but it's based
on
no. Yeah, look it up so we can share it.
I'm gonna do a quick look. Let's see.
Well, while he's looking that up, let's just go over some things that we already went over, and that's basically is, as healthcare professionals, and I tell my patients this all the time. My job is to educate and empower individuals to take charge of their own health. That is what I feel my job is. So, and you as a patient or an individual, you don't see a healthcare professional, but what, an hour a month maybe? So, but you're with yourself 24 hours a day. So we can help educate you on going down a healthy path, but you have to take charge of your own health, period. In fact, I wrote a book about this, and if anybody would like to get that book, it is on Amazon, and it's called Sickened: How the Government Ruined Healthcare and How to Fix It. #1 seller on Amazon. It was available on Kindle, available on audio, and available on paperback. And basically it goes into a little bit of my journey to start with. And, I was obese once. So, when I get called fat shaming and all that kind of stuff, I'm not fat shaming people. I'm telling people that obesity is dangerous, and I was there once. And I love people, and that's why I want them. That's why I'm talking about obesity being dangerous, because I don't want them to be obese and die an unnecessary early death. Did you find it, Shane?
I didn't. GFR is another one that I tend to.
Yeah, glomerular filtration rate. That's true. Are you sure that's not the one he used?
Oh, I'm sure it's not. No, there's a specific test that I had done, and I ordered it, and I'll probably order it every time, maybe or maybe not, actually, because I don't think it really matters. But trying to get back to this 1 second. Anyway, just so I can see. Anyway, point of it is,
if you find that, let us know, and we will put it on our edited show notes.
Yeah, I absolutely will. Okay, here we go. StreamYard. So I can't find it, but so actually, what I did is I didn't want my primary care doctor to freak out. So he's like, "Well, go get an ultrasound on your kidneys." Okay. So
I told you it's going to be fine, and it was.
So I went to a cash provider.
I mean, does it look like you're in renal failure? Serious?
Actually, it was cool because I liked the guy that actually did the ultrasound test. He's like, "You don't have bad kidneys." When I walked in, he says, "You don't have bad kidneys."
Right, exactly. Well,
so, yes. So he's looking at him, and it's no problem. And you know what? I will never get that test done again. I mean, I might get annual tests. I actually don't even see the need for it. I don't.
I know. I know.
It's about how you feel. I mean, I've optimized everything that I want to optimize. I have a good diet. I know what happens. I mean, I had some issues with a diet just recently after I came off my national championship, and my diet drastically changed. It didn't get bad. It got different, and my body responded in a weird way. And I actually had to test some numbers, and it's like, oh, okay. Yeah, but you know what? Bottom line is, here's how I fixed it. I went on an elimination diet. I actually didn't need to do tests to do that.
Right.
But elimination diet. Even though I don't eat poorly, I started getting psoriasis. I actually started getting, my toenails actually started turning yellow. It was really gross. It's because of my diet change. It wasn't that I eat bad.
Wait a minute. You didn't need a fancy biotech drug for your psoriasis? I am disappointed, Shane. They make good drugs for that stuff.
No, change my diet. Gone. No, I would actually get like little welts and stuff on my fingers, and I'd itch all over. And originally, it started happening to me with my feet, and I started eliminating things, and it was weird. I mean, I actually what happened is, I used to when I was prepping for my national championship, I was eating probably 20 eggs a day. Right. Yeah, my body actually became allergic to eggs. Are you surprised?
No, because you ate too many. Your body said, no, that's enough.
So I had to, so when I started eliminating things, I'm like, really? I got to eliminate eggs? And I did. Now, you know what? That was 6 months ago. I just started eating eggs again, 4 or 5 a day. No problem now.
Exactly.
No problem. But I mean, also, I had an issue with chicken, believe it or not.
You ate too much of it.
I was
Your body said you need something different.
3 pounds of chicken a day.
Right. This is another example, and Janet says this all the time about moderation. We're meant to, our bodies are meant to eat things in moderation usually. And 20 eggs a day, I mean, unless that's all you can do to stay alive, because there's probably times in human history where that's all they had at certain days. But for months and months at a time, that's not necessary. And that's one of the reasons why there's seasons for things, whether it be fruits or vegetables. There's seasons. You don't have them all year long. Usually. Right. Now, here's the problem.
No, I agree with you.
In modern day culture, we do have them all year long because we've got all kinds of refrigeration and freezers. Should we be eating them all year long? That's a debate. Maybe not.
Yeah. No, I don't disagree with you. And what was interesting is I probably had my labs done 3 times during this last year, where I changed my diet, and I was starting to itch, and it was diagnosed by my primary care provider as psoriasis, and I'm like, well, that's kind of weird. And, so he's like, well, let's use some cream and stuff. I'm like, hey, I don't mind doing that, but I'm going to fix this problem. I'm not going to fix the symptom. I'm going to fix the problem. And I did. Most people would be willing to do that. Every night they'd put on this cream on their hands and their feet and wear the gloves.
Well,
no.
Or even worse, they inject some systemic drug that kills their immune system. I mean, how many people are on these drugs and all they got to do is change their diet?
Well, so my point of it is I chased those numbers for those 3 different times. I actually didn't need to.
Right.
My body was telling me that there was inflammation. And that's the reason I don't like to treat symptoms. I mean, as a bodybuilder and somebody who wants to be healthy, if my body has psoriasis, if there's a reason, I got to fix that because it means I have inflammation. It means I'm not healthy. Guess what inflammation causes? Cancer, a whole bunch of other things, right? Cancer is an inflammatory disease. That's why it has skyrocketed since our diets have changed over the last 100 years, period.
Well, and let's look at it like this. It's like you wanted to fix the problem, not treat the symptom.
That's right.
So look at what happens when we chase laboratory values. Here's a perfect example. So, hey, you're a type 2 diabetic. Your insulin, your glucose is over 200. We're going to give you insulin and we'll lower that glucose. Great. My glucose is 70 now. Of course, your insulin levels are over 100. And by the way, giving insulin to a type 2 diabetic, yes, listen up and tell type 2 diabetics this if you know one or if you are one. Giving insulin to a type 2 diabetic is like putting gasoline on a house fire, period. I'll say it over and over again. You don't lack insulin. It's just like what you're talking about with the psoriasis. You don't lack some fancy drug. Eliminate what is causing it.
Yeah.
You know,
and there might be
always the answer.
There might be cases where you can't solve it. Okay, I get it. That's why there are needs for therapeutics and medications, right?
But why wouldn't you try it?
Why wouldn't you try it? It's the most healthy thing. Well, I'll tell you why I wouldn't try it. Laziness.
Laziness and insurance will cover their drug.
Insurance. Yeah, insurance won't cover your food.
Now, of course, that insurance is costing $1,500 a month, but man, it's covered.
You're right. Isn't that crazy?
Absolutely.
But here's what people don't think about. Think about the psoriasis, where my diet was telling me something's going on here and it's causing inflammation. So now then you relate that to insulin with a type 2 diabetic putting gasoline on a house fire. You still have inflammation in your body. Period.
That's my point.
Right. And it is absolute fact now, obesity and cancer are linked.
Absolutely.
There's a correlation.
Absolutely.
All kinds of cancers, whether it be breast cancer, prostate cancer, whatever. I mean, they're seeing a lot of these cancers are not genetic. You might have the gene to be susceptible to it. They're caused by environmental factors.
Absolutely.
And a lot of that is, guess what we do every single day? We eat.
Yeah.
So a lot of it is.
Yeah.
Or you smoke or you drink. Okay.
Yeah.
So those are the main things that are going to cause cancer: smoking, drinking, eating. When I say drink, I mean alcohol, right? That's what's going to cause it. And so anyway, but were my laboratory tests necessary? No, probably not. My elimination diet figured it. I mean, yeah, I had to eat, what they say. I went on this certain protocol, and I think I had to eat bison and salmon for 10 days. Guess what? Gone. Gone.
That's awesome.
Gone.
Well,
it was.
I mean,
And then I started introducing some berries and bananas,
right.
and I don't normally eat that stuff anyway, but it was just I'm going to see, hey, were there problems? Then I started introducing peanut butter. Oops, that was a problem. You know, this is weird. It's not now. I've started introducing it again. Believe it or not, stevia was a problem. Stevia was a problem for me. Now,
it's a plant. Stevia is a plant.
It is, and it's concentrated once you put it in.
Well, and it's from stevia leaves, the leaf of the plant.
Yeah,
leaves are not meant to be eaten in
they're
general.
Not, they're bitter.
I mean, they're plants that are very highly defended, so animals don't eat them.
Right, so insects don't eat them.
And I use stevia just to let everybody know I use it. I mean, but I'm just saying.
So, but certainly what it did show me too is and I think I've even gone on your podcast and said it was okay, and it might be okay, but I also had to stop using any artificial sweeteners. What are some of them? Aspartame. What are some of the other ones?
Saccharin.
Yeah, they were causing me issues. Now, here's why. Okay, I was on a chicken and egg white diet for about 3 months, and it sucked. It won me a national championship. Am I saying it's healthy? No, but that's what you got to do to win. That's what you got to do to win. You know, and I was absolutely shredded and peeled, and you don't get that with X amount of body fat. It's got to be low single digits, 1 or 2, 3%. Not healthy, right? But you know what? I was eating, stevia like candy because I didn't have any other sweets. And so I had all
Right.
these cravings. I didn't eat berries or bananas or grapes or anything. And I was in a caloric deficit for long periods of time. I was in starvation mode. Okay.
Yeah.
So I was hungry for anything and everything. Okay. So it just freaked my body out. My gut biome was probably screwed up. I think I probably had leaky gut. But I went on this, so I'm like, okay, I worked with a friend. She was great. And she says, well, you should go on this elimination diet. And we'll test you first and then we'll test you after. And I did that. I think I did that, like I said, 3 times. But I can say after my 10 days of elimination diet, gone. Salmon
Well,
and
for
bison.
one thing, I mean, I like the elimination part, but salmon is high in omega 3s, and
Yeah.
omega 3s are notorious for fixing skin problems.
Well, and now I take omega threes, and I did during my prep for bodybuilding, and I stopped taking them. Was that the only reason? I don't know. Is it the same when you supplement? Probably not. But you know what I try to do? I'm not as good as I was, but I try to get salmon once a week now, once a week.
Yeah.
And it's not the problem is in Idaho, especially, I don't get
Hard
good.
to get good salmon.
Yeah,
Yeah.
I'm sure trout's a cold water fish. Trout probably I don't like trout though either. But a good salmon, like if you're in Seattle or on the Atlantic coast, the Atlantic salmon, all it's pretty good. But yeah, most of the other, especially like tilapia and some of these other fish that are basically farm raised, it's just not the same.
No.
And they don't have the omega 3. So anyway, were those laboratory tests necessary? No. Will I do them again? Probably not. I mean, so I don't know. Maybe once a year I will. Maybe once every 2 years.
It's been a year since I've had any testing done. I don't plan on doing it regularly. I don't. I mean,
If I see an issue, I probably will. But again, you know what? You and I are educated enough, and I can always talk to you about it too, or do some of my own research where let's just say I start feeling weird. Well, I'll check 2 or 3 things, not a battery of things. I'm not going to go do this untargeted metabolomics where I'm going to try to look at every single, because it's going to be different all the time. Then you're going to go pick one. Oh, see, that's upregulated. That one's downregulated.
you'll chase it.
No,
Right.
no.
Right.
There's a really good conference that I was at. Oh, this is probably 20 years ago, 15 at least, where genomics, proteomics, metabolomics was all starting to get really popular. And some of the things that we're chasing, T3, T4, TSH, insulin, glucose, this is all about the metabolism. And you can chase these numbers and you can see what happens, and you call it metabolomics, what happens when you eat or exercise, and you can look at the numbers before and after, and you can call it, do they go up or do they go down? So is it upregulated or downregulated, right? And so this one guy, he comes in and it's an analytical chemistry conference. And so he comes in and he's like, yeah, so we took this patient's blood, we did all these tests, and we looked at NMR, and here's what happened before and after the treatment. And he shows these numbers, and the numbers changed after the treatment. And then he says, then we did IR, these numbers before and after. Then we did mass spectrometry before and after. Then we did GCMS before and after. And he said, so what we figured out is it came down to, and people need to personally think about this too, if they don't have insurance, but the insurance is just robbing them. But anyway,
Yeah.
he says it's not, but he was an English guy, so he had an accent. He said it's not metabolomics, or it's not really genomics, or it's not proteomics, it's economics.
Exactly.
That's
Exactly right.
That's the problem with our system right now, is insurance will pay for a lot of these tests, especially they talk about, well, it's preventative care. Preventative care is like,
Right here.
Drink, don't smoke.
Right here is preventative care. Has nothing to do with laboratory tests, has nothing to do with insurance. Right here. Chapter 6 of my book. The best health insurance you have is how you treat your body. It's not some policy you can buy. So don't and be very leery if an insurance company is paying for preventative care. That's not the kind of care I want, because usually that's mandated by the government. Do I need to say anything else?
Yeah, no. So it's been an interesting journey, and the history of testing. I love the tests that we actually can do, and it absolutely saves lives. I mean, I'm involved in analytical chemistry. I've developed some of these tests. I've developed these assays, so to speak. I've developed some of the technology. I'm involved in some of that latest research. Are they necessary on a personal basis all the time? No, I think they're overused. I really think we have to get back to the doctor-patient relationship where, doc, I don't feel good. Whereas the standard of care now is, well, let's do a whole battery of tests. Okay. Maybe once to see if there's something glaring. Okay. But Shawn, you know as well as I do, and I wanted to get into this. A lot of times here's what comes back. Gosh, doc, I have no libido. I'm tired all day. I'm not as strong as I used to be.
Well, look in the mirror. Well, gee, I wonder.
No. So I'm going to go on, right? I'm not, hey, maybe this person can't get an erection, whatever it is, all these personal things, right? They don't feel well, right? And their life is suffering. They're depressed, right? So you go to the doctor, you get these battery of tests run, and guess what? They come back and they say, oh, you're normal. No, doc, you weren't listening to me. I feel like dog crap.
I'm not normal. I'm not normal for me.
No, but, well, the tests say you're normal.
Well, wait a minute. The tests you test on, doctor, are for sick people. I'm not usually sick.
Well,
right, so I don't want to be a normal sick person. I want to be an optimal person.
Right. That's another thing we can talk about is what is the range of these tests? Remember, I know I had a good friend mentor. He was 90 some years old when he passed away 2 or 3 years ago. Okay. And he had not gone to the doctor since like 1951, something like that. Like,
Shane, that's probably why I lived into his 90s. Just saying.
Well, it could be, right? But the point of it was he didn't have laboratory tests.
No.
And he didn't go to the doctor every single year.
No. Well, here's one thing that you told me early on. Are you done with that conversation?
Yeah, I want to get back to what normal is here in a minute. Yeah.
Okay. So I remember years ago, you told me you told me about data. And, because you're an analytical chemist, that's what you do. You do data stuff. Your data, you analyze data. Here's the thing. Why do a test? This is why I quit chasing laboratory tests. Whether it be a testosterone level, whether it be, I know how I feel, when I feel, what I'm supposed to feel like. Is the data going to change treatment? No. I don't care what my glucose comes back tomorrow or right now. It is not going to change what I do. Mm-hmm. I know how to exercise. I know what my glucose does when I exercise, when I eat bad, when I eat good. It's not going to change. The number means nothing to me. So if it's not going to change the outcome, then why even do the treatment? It's like this. Like, for instance, I see people that the Aura rings. We've talked about sleep, the Aura rings. So somebody says, well, you should do an Aura ring. You know what? No, I don't want more data. I analyze enough data already when it comes to my exercise. I don't need more data. And there is nothing that ring is going to do to make me sleep better. I know what I need to do to sleep well. So why would I do it? It's like a sleep study. Our healthcare system makes a lot of money on sleep studies. Wait a minute. The number one reason people don't sleep and they have sleep apnea is because they're overweight. Okay. So why?
Or they're drinking
correct
before they go to bed.
Correct. That's correct. So why do a sleep study to get a CPAP when you can just eliminate those things? I mean, seriously. So one other thing, and I'll let you go back to what's normal. Okay. My wife is really good about giving this example. And this is so true. And I know people hate when I give analogies because I use simple analogies. I don't call myself a smart guy. I don't call myself a scientist. I like to just be rational. When you take your dog or a horse, give the animal, whatever, into a veterinarian, they know if it's sick. They're like, oh, yeah, your dog doesn't look good. What's the first question they ask, Shane?
What's he eating? What's he eating?
What you been feeding it? They'll look in the dog's mouth or the horse's mouth. Oh, the horse has bad teeth. No wonder he's lost 50 pounds. He can't eat. Oh, well, oh, no. But with humans, oh, well, you lack XYZ drug. Let me give you this drug. That's what your problem is. Or surgery.
That's standard of care now. And you think about what our grandparents used to do.
Standard of care, like Janet says, is not quality of care.
No. And so standard of care, it's just what they're trained to do. You can't blame doctors, but at the same time, it is their responsibility.
I blame the healthcare industry enough. I blame my colleagues.
I agree.
I really do.
I agree. They should know what the healthcare system is teaching and what's best for patients.
Yeah.
But think about what our grandma used to do, right? Because they didn't have running water where she grew up. I mean, they were dirt poor. So you didn't go to the doctor, and you had all your kids at home. You just didn't go to the doctor. He probably didn't even come out and visit. I mean, they lived in the Missouri Ozarks. I mean, so seriously, it's just how it was, right? Remember what she'd always say when you'd say, oh, I don't feel well. Have you been pooping? It's a really good,
that's a good question.
That's what the vet always asks, right? Like when you say your dog's sick, is he pooping or peeing? Well, no, he's not actually. That's an issue.
Right.
That might mean your kidneys or your bowels are not working.
Or you're not eating.
Or you're not eating or something.
Right.
Yeah, right, exactly. Or you're eating, but it's not being eliminated.
Right.
That's a big problem.
That's a problem.
Right? And so you have some kind of metabolic thing going on. But is there a laboratory test for it? Why don't, seriously? So obviously our grandma used to ask that. I assume doctors used to ask that question 50, 60, 70 years ago. They don't anymore. Why?
Now, I will say, we've got one good doctor watching right now, part of our fan club. Thank you, Dr. Madeira.
Hey, how are you?
And he would ask those kind of questions. So
yeah, that's true.
Know that. And
it's exactly true. And so, but let's go back to what normal is. And Dr. Sam talks about this a lot. And I've seen his data, and I've seen some other papers too, right? So let's go back to what normal is, right? So now you go to your doctor. Let's say you're a middle-aged man or even a woman. I won't get into the hormones. You know hormones better than I do, because women need testosterone just as bad as men do, and it does the same thing, and it doesn't make you aggressive. It actually is a mood stabilizer. It makes you actually less irritable. There's lots of data on that. So it's not a toxic male thing if you have testosterone. No. In fact, the people who go shoot up post offices and schools, they usually have low testosterone levels.
Oh, well,
they just do. They absolutely do.
Yeah.
They're more irritable. Okay. So anyway, let's just think about testosterone. Okay. So you go to your doctor, you say, hey, oh man, I'm not energetic. I'm depressed. I just don't have the energy I used to. I don't want to get off the couch. Maybe you have erectile dysfunction, whatever it is, right? And you go to the doctor, and he's like, okay, well, let's test your hormones. So you test your hormones, your testosterone comes back, and it's like, well, it's normal. Okay. Now you didn't hear me, doc, but
you didn't hear me.
But let's think about what normal means. Normal 30 years ago, it might even be 20. Dr. Sam could actually weigh in here. 20 years ago, the normal testosterone levels of a male were 50% more than they are today.
Absolutely. So when I first got into this business almost 25 years ago, we would never see, I wouldn't say never, that's a strong word. We wouldn't see 20-year-olds with suboptimal testosterone. We see it very, very frequently now. Dr. Sam could comment on that. It's horrible. It's horrible. But let's think about this. Testosterone is meant to keep us vital as men. It's meant to keep us vital to run.
Sean, careful. Not vital as men, vital as people.
Correct.
Don't be, because here's what some people are going to say. Oh, it's a toxic male masculinity
well,
thing.
Let them say that.
I know you don't care about that, right?
No, well, because I care about facts over feelings. Okay? and we're meant to be strong. We're meant to be run after things, and our testosterone is meant to be high. Well, if you're sitting on the couch eating Cheetos and drinking your wine, I mean, your body says, no, this guy doesn't need testosterone.
So you'll see 20-year-olds with suboptimal testosterone
all the time. Dr. Sam, if you want to comment on that, you're welcome to. Very frequently. Yeah.
Oh
and the numbers the threshold's getting lower and lower for age. It used to be we hardly ever did anything with men under 40. Now it's under 30. But I mean, seriously, here we go. I mean, call me whatever, call me a pig or whatever. But look at most men. I mean, seriously. And then Shane, do you remember seeing the picture of our grandpa when he was in the Marines 70 years ago? I mean, the guy was freaking ripped. I mean, you and I were wrestlers in high school, and when we saw those pictures, we were in good shape. He was freaking ripped, and so were his buddies, and everybody was.
Everybody.
I mean, it's like, so do you think Grandpa Needham's testosterone was optimal? Oh yeah.
He didn't need to test it. He didn't need to test it.
No, right.
Yeah, that's it. That's interesting. I did not know that it's that.
Oh yeah, very prevalent. So here's a comment Dr. Sam has. 1 year, my insurance in Washington State said vasectomies and migraine medication count as preventative care. See what I was telling you, Shane? Now, Dr. Sam, if you're still listening, this doesn't surprise me because vasectomies would be preventative care to somebody in the government or healthcare the industry. that doesn't want to pay for extra people. So it's population control. Yeah. I see. And of course, if you have migraines and migraine medication for preventative care, if you have migraines, chances are, especially if you're a woman, that's why women have more migraines. It's a hormone issue. It's a cycling issue, usually progesterone. Topic for another conversation. Then we got another fan, Tammy Freese. Thank you, Tammy, for watching. So we talked about normal. We got about 5 minutes left, Shane. I try to wrap these up. We could talk for hours. You know that. I try to keep these to an hour, a limit to an hour. So as we wrap this up, I mean, how would you like to conclude this conversation?
Well, let me talk to you about one other thing about my kind of elimination diet and a very common laboratory test today. And somebody, including maybe my primary care provider, I can't remember, when I told them I'm maybe food is causing my psoriasis, right? Well, let's do a battery of allergy tests. And so I had to put my analytical thinking cap on and think, wait a minute, what am I going to do with that data that I can't do through an elimination diet?
Right.
So I didn't take the test. And believe me, allergy tests, they're making a lot of money nowadays, but it's like, why not just go? And it's more healthy to do an elimination diet anyway. And what I found, I'm not surprised, 80% of the people are sensitive to gluten. And so I don't eat any gluten anymore. I used to be able to, last year, I used to be able to eat gluten once in a while. And I'm glad I can't even eat like one cookie now. Like I run on airplanes a lot.
No, you didn't do a test to figure that out.
No.
You did. Well, it's kind of like me. You know what? I know if I eat the wrong kind of dairy product, my GI reacts to it. I don't need a test to tell me that.
Right. But think about the dairy products. And then that's the problem with this test. They might say you're allergic to whey. I don't believe it. Are you allergic to whey in hard cheese, mozzarella cheese?
Exactly.
They're different.
And that's my key. Like ricotta cheese, I can tolerate ricotta cheese.
How biology puts a cheese together,
remember,
it's different. I don't know what it is.
You know, as an animal chemist, when you have a raw substance, plant-based or animal-based, we only know what we know to test for. But we don't know what's not in there because we haven't tested for it, because we don't know what's in there. Right. I mean, seriously, that's the whole problem. That is the problem with natural medicine, with pharmaceutical companies trying to isolate medicine active ingredients out of a plant. You don't know what you don't know. Right. So, red yeast rice is a perfect example. Lovastatin came from red yeast rice. It's the first statin, which was going to revolutionize cardiovascular disease. Of course, cardiovascular disease is at an all-time high 30 years after the statins came out. Go figure that one out. So not a hard thing to figure out, but the problem is in the statins called all kinds of side effects, whereas the red yeast rice didn't necessarily. Kind of like white willow bark with aspirin. Acetylsalicylic acid was one of the first drugs isolated from Bayer Pharmaceuticals out of white willow bark back in the 1890s or 1880s maybe. But all of a sudden when they came out with aspirin, it caused GI problems, it caused tinnitus, it caused kidney problems. White willow bark never did. Why? Because there's another ingredient in there probably that works synergistically, or also another ingredient that decreases side effects. You don't know what you don't know.
Well, think about how much bark you'd probably have to eat.
That's true too.
Probably, so it's
but that doesn't mean it doesn't work. It works for fevers. It works for pain. It works for inflammation. So it's more than just the dose.
Totally. And the active ingredient. You don't know what that active ingredient actually is.
You don't know. You don't know. You only know to look for.
There may be synergistic compounds.
Correct.
In that dose or that bark or whatever it is that are causing other issues. But I just found out every time I was on an airplane, I usually eat those 50-calorie biscuit things they give you.
120. In 2 cookies, there's 120 calories.
Okay, whatever. So I'm like, is it good for me? Not really. But, if this is the worst that I eat, it's okay. Well, by the time I'm landing, my fingers are just itching like crazy. I'm like, and I finally figured it out. So what's cool about it, I am actually thankful that I'm now allergic, sensitive, whatever to gluten. Because you know what? Gluten is in all kinds of crap. And to me, it's so annoying that, I just don't want to eat it.
Well, and that's why the topic for the conversation, but that's why I don't necessarily think it's gluten with everybody. Look at what kind of foods gluten is in.
Totally.
I love it when people drink gluten-free beer. Are you serious?
Here's what I ask.
Here's gluten-free beer. Oh, well, I'm allergic to gluten. Okay, well, keep drinking the beer. That's healthy. I mean,
Here's what I
seriously?
actually asked somebody. They didn't do the test. If I was really allergic to gluten and I was on, for example, $100,000 a year drug, which some people are,
Yes.
I said, you know what I would do? I'm just a curious guy and I want to be healthy. You know, I would actually go pick or grab whole wheat right from the wheat
Yes.
truck, stuff it in your mouth and eat it. See what happens.
My guess is you wouldn't be allergic. Now,
My
there
guess
is some
is too.
GMO stuff going on and genetically modified, but
My guess is you wouldn't be allergic to it. So
raw plants.
it's something else. I agree.
Right,
But
exactly.
think about what usually in our processed foods diet, gluten means crap. It means it is processed food, whether it be pasta, breads, cookies, cakes. I am very thankful now. I just can't eat that stuff. I shouldn't say can't. I choose not to.
Right.
I don't want to be itching.
You have an intolerance to it.
Right. It's irritating to
The
me.
answer is not some test to prove it. The
No.
answer is not some drug to so you can eat it all of a sudden. I mean,
My
seriously.
could I have went and somebody actually recommended to me, well, you should go get a gluten sensitivity test. Why? I just stopped eating cookies. What's the point? So that's the whole point. It's like, why would I go get a laboratory test when my body told me there's an issue here? My body told me there's an issue.
I was just discussing with a doctor last week or the week before who specializes in, functional medicine. And because I've always thought, Jen and I have always talked about it. It's like, you know what? We've eaten bread for thousands of years. I mean, look, it's in the Bible. It talks about bread in the Bible. So I do think there's something to do with the plants being modified. And there's probably more to it that I don't know.
Well, I actually, you might be right. And it's probably hard to prove. I actually think with a bread, for example, that it's how it's processed.
Yeah. Right.
Because, again, let's just think about this. Let's just think, extreme examples, because models are always good to think about, right? You take the wheat, mortar and pestle, you grind it up, and you make your bread. I bet you're not going to have an issue.
Exactly.
I just bet
you bake it in your own oven. You make the flour, and you bake it in your own oven. You lose all the raw ingredients.
Yep. You probably won't.
I agree.
You probably won't. So anyway, so is there a need for laboratory tests? Yes, I think in extreme examples, but you definitely have to understand your body, understand what your body is telling you. And there's so much information available, and it's not misinformation. There's a lot of information available about what these laboratory tests do and how you can actually interpret them. So educate yourself. That's my call to action. Educate yourself. So when your doctor says, "Oh man, you have a high creatine level," but you have a lot of muscle mass, or you just had a great workout the day before and you broke down muscle mass, well, yeah, you're gonna have some high levels there, or a high bun ratio or something like that. So just know your body is telling you something, and be educated enough so you can talk to your doctor about it.
Right. Know how to interpret the labs appropriately.
Yeah, absolutely.
As always, our goal here at Health Solutions is to educate and empower individuals to take charge of their own health. So Shane, tell us if anybody has any questions, the best way to get a hold of you.
You can get a hold of me at, you can give me an email. I'm on Facebook. I'm also on Instagram. You can just type in my name. You'll probably see my profile. You can also find my website at drsneedham.com, and you can email me through there. Again, drsneedham.com. That has some of my personal information on it as well. So visit there. And I'd love to hear from you guys. I really, really enjoy this. I also just want people to be healthy. I'm absolutely a direct speaker and a direct thinker. And what I mean by that is I'm going to give facts, because people aren't used to facts anymore. People are told certain things that want to just make them feel good. And I just want to give you facts that are actually going to be better for you in the end. I mean, I'm also a coach, and it's like sometimes I have to tell my athletes what they don't want to hear. And that's actually a really good coach. And that's why I'm thankful for Shawn and his wife, Janet, that they tell people what you don't want to hear sometimes. But it's like, if you're obese and you got to lose weight, you got to lose weight. That's just bottom line. And that's not what people have the courage to say nowadays. And so I'm thankful for Shawn and Janet and their podcast, and and then want to educate and empower people through health solutions. So thank you very much. Great opportunity. I'm really enjoyed this. And if you ever want me on again, I'd be glad to be on.
Of course, I'll have you on again. I think you've been on 4 or 5, 6 times, something like that. So
yeah, it's always fun.
You are our first guest ever, and now
that's right. I forgot about that.
Yeah,
that's
now
cool.
we're at the 300 and some episode. So, Tammy, thank you for the kind words as always, and Aunt Hallie, thank you for watching and listening. We really appreciate it. So, thank you, Hallie. And thank you, listeners and viewers, for tuning in today to Health Solutions with Shawn and Janet Needham. Tune in Wednesday, I believe, the day before Thanksgiving. You can look it up on my Facebook or on our YouTube because it'll be there. So we stream live on YouTube, LinkedIn, Facebook, and Twitter now. And so you can look me up there and find out when the next podcast is. But we're going to have Dr. Marion Moss on the podcast. We've had her on before. We talked a little bit about insurance today and how insurance is, health insurance is don't let them dictate your health. She's going to talk about how coverage, her motto is, she's going to talk about her most recent book, or paper, but her motto is coverage doesn't equal care. So just like we talked about a little bit today, just because you're covered on insurance and somebody, they cover something, that doesn't mean it's good care. So tune into that, watch for that, Marion Moss. Thank you, listeners and viewers, for tuning into Health Solutions with Shawn and Janet Needham. Thank you.